Fibroid is an abnormal non-cancerous growth arising from the smooth muscle of your womb or uterus. It can be found within the innermost lining of the womb. This is also known as submucous fibroid. Fibroid within the smooth muscle layer of the womb is otherwise called intramural fibroid. Subserosal fibroid is located within the outermost covering of the womb. It is unknown for now what it is causing fibroid. However, certain conditions increase women's risk of having fibroid. There is high chance of developing fibroid in women of reproductive age group. In addition, there is higher likelihood of a fibroid in women who have never given birth and those who are obese or whose any of their family members has fibroid. It is important to note that these risk factors are not sacrosanct. In other words, it is only few individuals with those conditions will end up having a fibroid. In addition, any woman of reproductive age group can develop fibroid, and having fibroid is not your fault. You must know that majority of women with fibroid do not have any symptoms. They were only found out to have fibroid incidentally during ultrasound that is done during pregnancy or performed for other unrelated conditions. The commonest symptoms for few women include heavy menstruation, pain during menstruation, and abdominal swelling. These symptoms may interfere with daily activity. Women with heavy menstrual bleeding will give history of usage of increasing number of sanitary pads, daily or fully soaked pads as compared with previous menstruations. The bleeding may also be associated with clotted blood or prolonged menstrual bleeding. It may also take the form of bleeding in between menses. Depending on the amount and severity of bleeding, hospitalization and blood transfusion may be required. Painful menstruation or dysmenorrhea is another complaint of fibroid. This is menstrual cramp that may be severe enough to prevent the ladies from going to school or work. It may also warrant hospital admission. It is not uncommon to see women with fibroid presence with abdominal swelling big enough like a pregnant tummy. Some of them may even tell you they are pregnant or have been pregnant for years. When you noticed any of these symptoms, please see a doctor immediately, especially gynecologist. Majority of women with fibroid will become pregnant without any difficulty. In rare cases, fibroid located in the innermost lining of womb, otherwise referred to as submucous. Fibroid may impede the attachment of fertilized egg, small baby, into this innermost lining of the womb, resulting in miscarriage. Very rarely, this submucous fibroid may also obstruct the opening of the fallopian tube into the endometrial lining, prevent the ascent of the sperm to meet egg and become small baby. You must know that treatment options for fibroid depend on the age of the women, predominant symptoms, and desire for future pregnancy. These options include watchful waiting, drug, and surgical treatment. For a smaller symptomatic fibroid, no treatment is required. For women whose predominant symptom is painful menstruation, treatment options include over-the-counter pain relief or birth control pills or other hormonal agents. Hormonal agents, such as birth control pill or clot-forming drugs, are used for those with heavy menstrual bleeding. Surgical operation is reserved for those with very large fibroids and when there is no response to drug treatment. Surgery may involve removal of fibroid or those that destroy fibroid leaving the womb intact. This approach is appropriate for those who are desirous of future pregnancy. However, there is concern of regrowth of fibroid with this approach. The definitive treatment option for fibroid is surgical removal of womb, especially in those who have completed their family size or do not want to become pregnant. Your healthcare providers will counsel you on these treatment modalities and you will be guided appropriately on your chosen modality of treatment. Kindly subscribe to this channel for similar videos and share it with friends and family.